Welcome to this recorded informational presentation. Today, I will be reviewing the Victims of Crime Act Notice of Funding Opportunity for the Trauma Recovery Centers. The purpose of this Notice of Funding Opportunity, or NOFO, is to fund comprehensive direct services for historically underserved or marginalized victims of violent crime and their families through the implementation of a Trauma Recovery Center, or TRC model. This is a pre-recorded webinar and there won't be an opportunity to ask questions. So please ask questions via this email, cja.vocatrc@illinois.gov, and you can do so until July 27th. Substantive questions and answers will be posted on our website, so please check there regularly. Grant awards resulting from this opportunity will have a target period of performance beginning October 1st of 2023 and run through to September 30th of 2024. In other words, a full 12 months. Additional funding up to 24 months total may be awarded after the initial funding period, contingent upon satisfactory performance and availability of funds. Total funding for the grant program will not exceed 36 months. The notice of intent is due by July 21st, and the applications are due by 5 p.m. July 31st. The notice of intent is needed so that we can plan for our reviewers, as well as to give time for ICEJA staff to check GATA registration of applicants. Eligible applicants include public or nonprofit hospitals with a Level 1 or Level 2 adult or pediatric trauma center designation, or a community-based nonprofit agency that provides mental health services and is engaged in a formal partnership with a hospital that would itself be an eligible applicant as described above. An entity may not apply for a grant until that entity has registered and pre-qualified through the Grant Accountability and Transparency Act, or GATA, grantee portal, which you can find at www.grants.illinois.gov/portal. Registration and pre-qualification are required each state fiscal year. Applicants must have completed the GATA pre-qualification process and received approval of their Internal Control Questionnaire, or ICQ, from their state cognizant agency by the date of application. Applications from agencies that have not received ICQ approval will not be reviewed. During pre-qualification, verifications are performed, including a check of federal SAM.gov exclusion list and status on the Illinois Stop Payment List. The GATA grantee portal alerts the entity of qualified status or informs how to remediate a negative verification, such as having an inactive DUNS or not being in good standing with the Secretary of State. Inclusion on the SAM.gov exclusion list cannot be remediated. Agencies that do not submit the notice of intent may not receive assistance with their pre-qualification in the GATA system. Looking now to the core elements of a TRC application. Applicants must propose to serve victims of violent crime who are historically underserved or marginalized adults and or minors. Applicants also must describe how each element will be implemented and how that implementation is appropriate for the primary communities being served. Applicants who fail to clearly integrate the elements into the program design may not be scored. Looking at these elements, we'll start with number 1, assertive outreach and engagement with underserved populations. This means you should conduct outreach and provide services to victims of violent crime who are historically underserved or marginalized, including but not limited to survivors who are homeless, are chronically mentally ill, are members of immigrant and refugee groups, are disabled, have severe trauma-related symptoms or complex psychological issues, or are of diverse ethnicity or national origin, as well as victims who are minors, including minors who have had contact with the child welfare or justice system. Next, inclusive treatment of victims of all types of violent crimes. This means providing services to victims of a wide range of violent crimes, including but not limited to victims of sexual assault, domestic violence, vehicular assault, human trafficking, and aggravated battery. In some cases, family members may also be served. For example, in cases of homicide and in cases where the victim's experience and/or healing directly and profoundly impact the emotional or psychological health of family members. Third, comprehensive mental health and support services. Mental health and support services must be comprehensive, structured, and evidence-based. Comprehensive services may include crisis intervention, individual and group treatment, medication management, outpatient substance use disorder counseling, case management, and assertive outreach. Methods of delivery should be flexible, increase service access, and remove barriers by providing services in locations that meet the victim's needs, including being on site, in the home, in the community, or other locations. 4. Multidisciplinary staff team. Staff should consist of a multidisciplinary staff team, and this must include, at minimum, a program director, program coordinator, clinical staff, such as licensed psychiatrists, psychologists, social workers, and marriage and family therapists, and a project evaluator. The TRC clinician staff are licensed clinicians, or in some cases, a closely supervised clinician engaged in the applicable licensure process. Clinical supervision is provided to staff on a regular, ongoing basis to ensure the highest quality of care and to help staff constructively manage the vicarious trauma they experience as service providers to victims of violent crime. Number 5, coordinated care tailored to individual needs. Psychotherapy and case management are coordinated through a single point of contact for the victim, with support from an integrated, multidisciplinary trauma treatment team. All treatment teams shall collaboratively develop treatment plans in order to achieve positive outcomes for clients. 6, clinical case management. Services shall encompass assertive case management, including but not limited to accompanying a client to court proceedings, medical appointments resulting from the victimization or other victimization-related appointments as needed, assistance with victim compensation applications, or the filing of police reports, assistance with obtaining safe housing and financial entitlements, linkages to medical care, providing advocacy regarding employment, and working as a liaison to other community agencies, law enforcement, or other supportive services as needed. Number 7, inclusive treatment of clients with complex problems. Clients are not excluded from services solely on the basis of emotional or behavioral issues that result from trauma, including but not limited to substance use problems, low initial motivation, or high levels of anxiety. Next, use of trauma-informed, evidence-based practices. TRC mental health clinicians shall adhere to established, evidence-based practices, including but not limited to motivational interviewing, seeking safety, cognitive behavioral therapy, and dialectical behavioral and cognitive processing therapy. Finally, accountable services. Applicants should provide holistic and accountable services that ensure treatment shall be provided for up to 16 sessions. Mechanisms to extend treatment may be integrated for those with ongoing problems, and a primary focus on trauma treatment may be extended after special consideration from the clinical supervisor. Extension beyond 32 sessions requires approval by the multidisciplinary team, or MDT, that considers the client's progress in treatment and remaining community need for services. Now, it should be clear too that on the whole, applicants must propose to serve victims of violent crime, again, who are historically marginalized, adults and/or minors. Moving on to staffing and training requirements. As I mentioned earlier, the staffing plan is going to need to include the following members of the multidisciplinary team at a minimum. First, the program director. This position oversees the entire program, manages relationships with other service providers, and can conduct trainings and provide supervision of direct service providers. This position must have a clinical orientation. Also, VOCA funds can only be used for the direct service staff supervision, training, and interagency coordination. Next, for the program coordinator position, this position would manage the day-to-day operations, as well as supervise direct staff and services, as well as foster interagency coordination and conduct trainings. Regarding clinical staff, these positions may include psychologists, social workers, and marriage and family therapists. Clinical staff are master's level licensed clinicians or they're pursuing licensure. Team members must have expertise or acquire the necessary training to serve the target population of their TRC program. Next would be the psychiatrist for medication management. And lastly, the project evaluator. Project evaluator position manages programmatic documentation, reports, and statistics, as well as assessment completion and monitoring services to ensure the TRC core elements are being followed. Additionally, applicants may include a position for a peer supporter. These are non-clinical positions that can assist with the identification, engagement, and facilitation of community resources. This position should not replace clinical staff, and it must be integrated into the team structure. Now, regarding training, initial and ongoing training is a critical component of any TRC model. Within the program narrative, applicants should outline the training needed for program staff, for example, training in evidence-based treatment modalities, as well as outline which program staff are already trained and or which trainings will be sought for staff who do not possess the core skills or competencies or who have yet to be hired. In addition, applicants must explain how clinical supervision will be provided to staff to ensure the highest quality of care, including how self-care will be incorporated, as well as opportunities for professional development. Staff at the TRC should be equipped and trained in culturally competent services to the underserved and marginalized clients that their program will serve. Now, regarding letters of commitment and formal partnerships, applicants should include signed letters of commitment from the coordination group members outside of your organization, as well as partnering community agencies. Also, applicants that are community-based organizations must submit evidence of their partnership with a hospital. Looking to the program narrative, this is something you'll use a posted Word document in Amplifund. Now, do not delete the questions or alter the formatting of that document in any way. Make sure that you use Times New Roman, 12-point font. Also, the program narrative cannot exceed 20 pages. Make sure your answers are clear, detailed, and thorough. Make sure that you look to the scoring criteria to make sure you've answered each question fully, as well as refer to the core elements in direct services. Some examples of trauma-informed models, by the way, that you may use in your program narrative or refer to would include things such as the Sanctuary Model and the U.S. Substance Abuse and Mental Health Services Administration, or SAMHSA, trauma-informed approach. Now, to the budgets, allowable costs under VOCA funds can include things such as the hiring and training of staff, including the TRC program director, clinical director, and mental health clinicians. Also, you can have equipment and supplies integral to the providing of the mental health treatment services. Now, just to be clear, also with regards to equipment versus supplies, equipment would be anything that has a per unit cost of $5,000 or greater. So, for example, a laptop that say only costs $800, That wouldn't actually be equipment, that would be supplies. Also, you can include costs that address the needs of victims. There are certain limitations. Read over the budget template, and it should give you some other information as well as the more detailed NOFO. And lastly, all program operating costs related to providing services and prorated to use for this program. Now, with regards to cost sharing or matching, that per the National Emergency Pandemic Mandatory Match Waiver Policy, there is no match required for this application. Now, grantees do have the option of either accepting that match waiver opportunity or declining it. So those that wish not to participate in the match waiver, in other words, they wish to include it in their submitted budget, will also be asked to submit a formal declination letter. Now, if the applicant wishes to decline the match waiver and include match in their submitted budget, match is calculated as 20% of the total cost of the project funded. Federal grant funds requested under this application may not exceed 80% of the total cost of the project. Match can be made in both cash and or in-kind contributions. Cash or in-kind resources used as match must be spent in support of the program's goals and objectives. Now, in-kind match includes volunteered, professional, or personal services, office materials and equipment, workspace and facilities, and non-program funded victim assistance activities. Any reduction or discount provided to a subrecipient shall be valued as the difference between what the subrecipient paid and what the provider's nominal or fair market value is for the good or service. The value placed on volunteered services must be consistent with the rate of compensation paid for similar work in the program or the labor market. The value of donated space may not exceed the fair rental value of comparable space. The value placed on loaned or donated equipment may not exceed its fair rental or market value. As far as the goals, objectives, and performance metrics that you'll be completing as a separate table in part of this application, funded programs will be required to submit quarterly progress reports based on the objectives applicant agencies propose in their response to this solicitation. Now, selected programs will be required to submit quarterly data reports through the OVC, that's the Office of Victims of Crime, Performance Measurement Tool, or PMT system, as well as the submission of a series of narrative questions that will be sent into ICEJA every quarter. The objectives selected during the application process will be monitored throughout the grant, and they can be adjusted prior to the beginning of any continuation of the program. Now, again, with regards to substantive questions and answers, questions may be submitted via email at cja.vocatrc@illinois.gov. Now, again, the deadline for submitted questions is 5 p.m. on July 27th, and all substantive questions and responses will be posted on the ICEJA website at https://gata.iceja.cloud/. Now, to be considered for funding, applications must be completed and submitted via Amplifund by the application deadline of 5 p.m. Central Standard Time, July 31st, 2023. Applications that do not follow the mandatory formatting will be eliminated from consideration for review and funding consideration. ICEJA encourages applications be submitted at least 72 hours prior to the formal deadline to ensure completion of the submission process. With regards to the scoring of applications, proposals will be reviewed by a panel of ICEJA staff, as well as key stakeholders with expertise in the Trauma Recovery Center models. Application scoring an average of 65 points or higher may be recommended for funding. Now, after applicants are selected from each region, applicants will be selected based on their overall score, with secondary consideration given to geographic diversity and proposed program design. Applicants with equivalent scores will be selected based on scores in the proposed program category. ICEGA reserves the right to reject any or all incomplete proposals, proposals including unallowable activities, proposals that fail to meet eligibility or program requirements, or proposals that are otherwise deemed to be unsatisfactory. ICEGA also reserves the right to invite one or more applicants to provide necessary clarifications prior to scoring, and to invite successful applicants to submit amended proposals and modify budgets that include unallowable or unreasonable costs. That ends our recorded presentation for the Notice of Funding Opportunity for Trauma and Recovery Centers. I thank you for your time and wish you best.